Hello and welcome. My name is Dr. Maeve Kenningham from Dr. K's Clinic, and I want to talk to you about a very common cosmetic concern my patients seek me out for, and that's etched forehead lines. Some people are quite distressed by them, they find them very aging, and my favourite way of treating this type of cosmetic problem is to use a prescription-only medication called botulinum toxin. Now, you may recognise the brand names Botox, Azalure, Bocouture, Dysport, and these, as I said, these are prescription-only medications, so you need a medical assessment to decide whether this treatment is appropriate for you. What makes the treatment for etched lines of the forehead quite difficult is if the patient also presents with quite drooping eyelids, and the two are very closely connected. So when you age, or you've lost weight, or you've had a lot of sun damage over the years, the eyelids can droop quite a bit, and your brain tells you to lift your eyebrows to get rid of the impediment of your vision, and by doing so you have marked forehead lines as a result. It's an unconscious thing that your body wants to do to make sure the vision is complete. And I'm just going to show you the muscles of the forehead and frown area to explain this situation a bit more thoroughly. So here we have the forehead muscle, which is called the frontalis. So this lifts droopy eyelids away from the eye so vision isn't obstructed. And in doing so, forehead lines are created. So if you want to get rid of these lines totally by injecting toxin into the forehead, what will happen is the muscles will relax, and this will cause the brows to drop, which can be extremely unflattering, especially for a lady. So what can be done? What can be done is one injects into the frown area. This muscle complex acts to pull the brows down when it is weakened with toxin that's been injected, the brows go upward. And unfortunately, that then means the forehead lines get much worse. And so this is why you need an injector who really understands and is used to the anatomy of the face. And the main aim really is to inject around the frown so that the saggy eyelids are lifted, but then have a sprinkling of toxin off the forehead so that it isn't brought down, but yet there is some softening of the lines without causing the eyebrow droop. The flip side is, if you don't put enough toxin into the forehead, what will happen is the upward pull of the frontalis, which is now acting unopposed if the procerus of this complex has been injected. So if this has been knocked out, the frontalis works much more vigorously, and in some cases what happens is there's a Spock-like effect where the eyebrows are too raised, and that can look unnatural and so a little unsightly as well. And what patients often find very frustrating is that the lines can still be there, although the aim is to get them that little bit softer. And unfortunately, because it's just a sprinkling of toxin in the forehead, the toxin doesn't last quite as long there as it does along here. But it should adjust itself, and it should be balanced for the entire time if your injector gets it quite right. So the last thing I want to mention is a big thank you to Dr. Tony Burke, who has been very generous in sharing her muscle or face muscle app, which I find very useful for educating my patients, and also to my daughters for letting me borrow their lovely little butterfly, pull my hair out of my forehead so I can demonstrate. Hopefully that's been educational, and if you have any problems or queries, please get in touch, and I'll do, maybe my next tutorial will possibly be on toxin around the crow's feet. Okay, I'll see you soon.